This podcast is for general information only. It is not intended as a substitute for general healthcare services. If you have medical conditions, you need to see your doctor. Use of this information is at the user's own risk. Welcome to FitRx with Dr. Greg Dennis. Join me as we challenge the standard sick model of healthcare. This is your source for everything health, wellness, prevention, fitness, biohacking, and more. Hello, everyone, and welcome to another edition of FitRx. I'm your host, Dr. Greg Dennis, and I have another physician today, and we are going to talk about all things kind of men's sexual wellness. And I've talked a little bit about that in the past, and that's certainly something I do a lot of here in my clinic, as probably most of you know, and so I'm excited to hear what she has to say. My guest is Dr. Anne Trong, MD. She is a board-certified physician with over 20 years of clinical experience, and she is a recognized leader in men's health, particularly in regenerative medicine. She is passionate about healing the cause of male sexual dysfunction, not just masking the symptoms, but actually treating the underlying cause. She has written a book called Erectile Dysfunction Fix. She also has a YouTube channel, which we'll talk about and get into. Yeah, just looking forward to what she has to say. So Dr. Trong, thank you for being on the show.
Well, thank you for having me here, Dr. Dennis. I'm glad to be here and disperse as much information as your listener desires on sexual health and longevity and better living.
Yeah. Well, first, I always like asking my doctors how they got into this. So you were a practicing physician in kind of the rehab space, and how did you go from that, and especially being a female doctor? It's kind of unusual to specialize in male sexual dysfunction, but talk about that transition. How in the world you just got interested in that, and now have become an expert after all these years. Talk to us a little bit about that.
Yeah, well, actually, it's an evolution. I trained at an allopathic medical school, which teaches you an allopathic method. And then when I came out in '97, I'm a pain management doctor or a physiatrist, and we do injections and medication and so forth. That's how I was trained, and I realized I was not getting my patient better. I was actually making it was just padding the problem, and they keep coming back is that I wanted to look at long-term solutions. So I started learning how to do acupuncture. And once I learned how to do acupuncture, a whole world opened up to me about healing, holistic approaches, and whole body healing, and then treating the cause of the problem. Because in acupuncture, they talk about energy that travel to your body and then stagnation of that energy that promote disease. And then I started learning about prolotherapy because I did a lot of cortisone injection. I do a lot of spine injection. So I wanted to learn methods that will treat long term rather than if I give somebody a cortisone injection, they will come back to me in 6 months and with the same problem. And I realized that I was harming them more by giving them cortisone injection. And then I have patients that will start bleeding if I give them anti-inflammatories that they will bleed in their stomach because that's one of the side effects of anti-inflammatory or bleed down below in their GI tract. So my journey started with that, and then so I went to prolotherapy, and then in 2005 I started doing platelet-rich plasma, which is using your own healing cells, which are the platelets in your blood to help you heal. And that was, I haven't turned back since. And since then, I've been using platelet rich plasma. But how my journey started in male sexual health was that around 2015, yeah, 14 is when I got into sexual health, was that my husband had cardiovascular disease and he was taking medication that affected his sexual function. And being in the field, I didn't want him to take Viagra or Cialis. I wanted to explore more of a root cause solution than not. So I kind of dive into, all right, how what can we do to restore his function again? And also, since I was already doing stem cell therapy with the platelet-rich plasma, which is harnessing the healing power of your blood, I started experimenting. Hey, if I can do this in joint and in spine and in shoulders and in muscles and tendon, I can certainly inject it in the sexual organ to restore function. And as it come out, my husband was my first patient out of many, and since then we have treated 7,000 patients. So it's an exploration of trying to treat root causes. But I certainly came from a very personal angle because of a family member, and I realized that the men is being brainwashed that if they're not performing well in the bedroom, the only solution is medication, which is so far from the truth at all. And since I was able to restore my husband function, I wanted to do that with my patient as well. And since 2014, we've been doing that for the last 11 years.
Okay. Well, I'm interested in learning about your approach. And so let's go ahead and get into that a little bit. I mean, there's a lot to talk about. I mean, obviously, it's not just about erections, but, there's libido and there's hormonal issues. And I'm sure we'll get into all that. But you have kind of the six systems that create your erection. And so I think it would be good to kind of dive into each one of those. And let's start, if we will. The first one you have is the brain. And of course, we all talk about how it starts in the brain. And I think men in particular kind of forget that. It doesn't start in the penis, it starts in the brain. And so I talk about, I guess, what you see there and how how you coach patients as starting there in the brain.
Right. Well, the sixth system, we call that the get hard system. Okay. And it's an evolution with the past 10 years that we realize in order to treat a sexual ED, you have to use multiple approaches. So it's not just, okay, let's treat the penis and that's it. You have to treat the body, the whole person. And that's number one. Let's define what ED is. ED is actually more of a wider spectrum than just inability to get an erection. ED is defined as the inability for a man to get satisfactory sexual relations, that he's unable to penetrate and that it bothers him. Now, the word "it bothers him" is very important because men, if you drink a lot or if you are distracted, yeah, you can lose your erection. That's a 1 or 2 time thing. But if it's more prevalent and it bothers him, then it is ED. But also, I want to stress that ED can also be as longer to take longer for you to get an erection, or that you have a partial erection, or that you have an erection and you lose it. And it also include inability to orgasm, inability to ejaculate, as well as all the way to total impotent. So it's a whole spectrum. Okay, so but most men don't realize that, hey, if I'm not as firm as I used to be, that it's not ED. That is part of ED as well. But the most important thing is that bothers him, then it is ED. So that's number one. So then when we realize that we can't just address the penis, we have to address the whole person. And really, the brain is the largest sexual organ. It is the largest sexual organ. If it doesn't begin in the brain, it doesn't go down to the penis at all. And so that's why when you're distracted, you're stressed, you're depressed, you're anxious, you're not going to be able to get an erection because that the in the brain is where you get the five senses, where you get a sensation of touch, would give input to the brain, and then visual, what you see, what you hear, what you smell, and what you taste. Those are the five senses that feed into the brain. It gets processed in the brain. And then from there in the brain, there are chemicals, and hormones that gets released from the pituitary gland, which is the gland right in the mid part of your brain, that gets released, that starts the chain going, that sends signal, and hormones also get released that sends signal to the nerve in the back of your head to go down the spinal cord. So, in fact, by in the three in the sixth system, the brain, I mentioned the hormone that gets released in the brain, and also the nerve, right, as well. So all of that, and then the psychology. I mentioned the psychology before, because psychology is important. I see the mood as almost the psychology or the mood that you have almost like as a filter. So if you have these sensations, but yet you're anxious or depressed or you have anxiety, it gets filtered, and then that signal is not going to be as strong, or it's actually attenuated or decreased, and it's not stimulating the release of all these hormones that need to start to initiate the arousal. The arousal start in the brain, the arousal response that initiate everything else. So that's why the brain is the regulator at this point, and we stress that so much because every man that has ED, even though it's the physical cause, it also has a psychological component as well because he's thinking, okay, well, last time, I lost it, and then this time here, he's thinking, well, is it gonna happen again? So it's
Hmm.
almost like this self-fulfilling prophecy, right?
Right.
Where, it didn't work out well last time, this time, I hope it's not, but then you're also worrying about it. And the more you worry about it, the more you are concentrating on it, the worse it gets. So it's almost like kind of getting out of your head and being able to relax, enjoy the moment, and focusing on the intimacy, which is, touch, foreplay, your partner, all that, communication, nonverbal communication to really allow you to initiate the initial response. So we know that work because in patients that are quadriplegic, meaning that they are paralyzed from the neck down, can still get an erection because of the stimulatory effect of the brain. So that's how powerful it can be. And I've seen it where men that I've seen like a 30-year-old Marine who is fit, no medical problem whatsoever, no high blood pressure, no high cholesterol, no diabetes, is fit. But because he was stressed at work, he was not able to have sex with his wife. And even the doctor at the military give him Viagra and Cialis.
Hmm.
None of that worked on him at all. He came to see me out of desperation. He said, "What's wrong with me? How can I do that?" So I did a blood study test called a penile Doppler ultrasound, where I did an ultrasound of his penis to evaluate for blood flow with an erect penis, and his blood flow was fine. And we did blood work, his hormones level, all that was fine. So what it mean was that he was just stressed, and he what because of the distraction, the stress, he was not able to do that. But after I reassured him that all the blood work's good, the test was good, you are good, ready to go. You just gotta have less stress and not think about it. He called me a day later and said, Doctor, you were right. I stopped thinking about it. My erection came back. But what I'm trying, the point of the story is that even Viagra wasn't even working for him because of the strong factor that is in his brain. So our first system is focusing on the brain and teaching men that, teaching men to really focus on the positive thing, what's happened in the past, is in the past, and focus on the five senses of that I mentioned earlier, and just be in the moment. Be
Yeah.
in the moment and get that, because let that initiator, the arousal process start in the brain. And I want to mention that would be something interesting for your listeners is that the sexual center for in our brain is the primitive. It's in the primitive area within the deep part of our brain, and the most primitive area is we share the same brain as a salamander because it's such an innate nature of being human that we share this with animals and salamanders and so forth, and it's something that it a core to a human being, and I wanted to stress that because it should be almost automatic and subconscious. And if we let the conscious mind control that part of it, then that is not gonna be processed. So that's why the first part is the brain,
Yeah.
and the second part after that is the hormone, which then gets released in the brain, and then the nerve, which also when it gets stimulated in the brain, that transferred to the back of your head here down the system called the sympathetic and parasympathetic nervous system. And when you want to get an erection, and for women too, not just for men, um, it's when you want to get aroused and more blood flow, you need to be in the parasympathetic state, which is the nerve where it's the parasympathetic state is the relax, it's called the relax and breathe state where you have to be in a relaxed mode. You cannot have an erection if you're not relaxed and you're not in the moment. So that gets us to system number three. And then number four is when you get the nerve stimulate is the blood vessels. All right. It is the blood vessel. You have to be engorged. So your heart rate start beating. And when your heart rate start beating faster, it opens up the artery. The arteries are the blood vessel. Imagine blood vessel like a pipe that runs from the heart that goes to the organ. That's the artery, and then the veins bring the blood from the organ back to the heart. So then the artery opens up and more become more flexible, bring in more blood flow, and then that blood flow goes to the penis, which then engorges, and then we got the muscle, right? The muscle of the penis there engorges, and that's what create the erection. The penis muscle is like a sponge. It's really not like a biceps muscle. It's a sponge. And in fact, when a man get an erection, he gets 400 times more blood flow in it than a non-erect penis. It's that much blood flow and engorgement. Think of it like a sponge. When it's dry up, it kind of crinkle. When it's full of water or blood, it like fluff up. And that's exactly how really it's a smooth muscle. Um, it's a smooth muscle, and when the smooth muscle line the lining of the arteries and the vein, allowing it to expand. So, in order for you to get an erection, you gotta be relaxed in the mind, and you gotta be relaxed in the penis, because the penis muscle has to be relaxed. When the penis muscle is relaxed, it can be able to accommodate the increased blood flow into it to hold the blood there. So, and the penis muscle gets relaxed when your mind is relaxed. Again, back to the brain is the largest sexual organ. So that's kind of the sixth system that interplay with one another. But the process really starts in the brain.
Okay. Well, let me kind of circle back to that and maybe talk about, kind of treatment and maybe your treatment strategy of each one. As it pertains to the brain and emotions too, we could probably couple those together. You mentioned, well, obviously you want to, just don't worry about it and stress less. But especially if men have had these issues, they are thinking about it and it's just hard not to and it's easy for us as providers to just say, oh, just quit stressing, and don't worry about it, but that's probably hard to do in reality. So how do these guys do that? How do they just quit worrying about it and just relax?
Right. I almost make an analogy like as if like you ride a bike. When the first time you ride a bike, you're gonna fall down, and you're not gonna get that balance. But the more you try, the better you're gonna get. So what happened is like it's an unknown. So men when they lose their erection, they're like, oh my, they blame themselves, like, what's happening? Why am I doing this? And because it's the unknown. There's a lot of unknown with sexuality. That's not something that we're taught in elementary, not something we're taught in high school, even, right? Such a taboo topic, and it's such hush hush in the closet. So we have to learn sexuality and sexual and sex, on our own. And oftentimes we're not taught the correct way how things are. So that's number one is that be reassured. Men need to reassure that, if you start to experience that an erection less firm and it's being more consistent, start to bother you, but get to know the reassure that there are options for you to be able to treat that erection yourself, to be able to make your erection better. That's our message that we wanted to get out there is that, oftentimes we see our patients facing the same dilemma, and is that because they don't know that there are options besides Viagra and Cialis for erection. So so the thing is that, is to know that, there are options that I can do this, but also to know that your mind needs to be relaxed as well. So if you keep thinking about what's in the past, it's gonna come and haunt you. So that's what I correlated that to riding a bike. If you ride a bike and, I don't know about everybody, when I ride a bike, I fell down. When you first to learn how to ride a bike without the training wheels, you may fall, but if you give up, you always gonna have that trauma of, oh my God, I can't ride a bike, and next time I ride a bike, I'm gonna fall again. But just know that what's in the past, you can't change it. But what you can do going forward is you can change it. You can make your erection better without medication, and we can dive into things that you can do to improve your performance. So that's what I was trying to stress out. That oftentimes the unknown make you more stressed out, make you more anxious because you don't know what to do, and then you take the medication, and when you take the medication, you're going down a dark path because the medication may hurt in the short term, right? For months or years, but it's like taking pain medication. It's just covering up the problem. It's not solving the root cause of why you have ED. And oftentimes, men, you just realize that maybe you drank a little bit too much alcohol. Too much alcohol can affect erection. Smoking, definitely gonna kill your erection. Even too much vaping, and vape now is a combination of both nicotine and THC. It depends on what you put in there. Vaping, alcohol, what else did I mention? And your diet, what you are eating also affect that too. So these are the things that I want to reassure men that if you start to find that you're not performing as well as you are in the bedroom, know that there are other alternative and seek that out. Listen to Dr. Dennis podcast, check out our website, our YouTube channel. We give men the success path on what they need to do, and just kind of know that, the more anxious you think about the more you think about your ED, or the more you think about not able to get erection, it's gonna make it worse.
Hmm.
So think of it like your first bike. You're gonna try again. You're gonna be in the moment. Oftentimes, when you're in the moment with your partner, when I say in the moment, intimacy is like, all right, the foreplay, like focusing on kissing, focusing on touching, focus on music, turn on music, listen to the music, focus on things that make you relax. Now alcohol initially may make us relax, but too much alcohol is not too good. Maybe have
Mhm.
one drink to help you relax, but use music to relax you. Use imagery, all right? So when you're in foreplay with your partner, use imagery. All right, and even fantasy and massage. Massage is a very good way because you're focusing on your partner. You're not focusing on, oh my God, I'm gonna get erection or not, because these all of these things, they feed on one another, right? And a lot of men, think that, hey, if I get into with my partner in 5 minutes, I'm gonna get erection. No, you gotta kind of ease your way into it and have the sense, get the sensation, get the arousal going first. You're not gonna be, if you're in your 50s, you're not gonna be like you were in your 20s when you,
Hmm.
you see someone walk by, they're attractive, you're gonna get erection right then and there. Things have changed, and the reason why we see more men as they get older with ED is because when you get 50%, well, let me start with 50% of men over 50 have ED. And I think it's a lot more now because ED is influenced by your diet, how much you exercise, your weight, stress level, and sleep. Those are the four things that really affect your erection. And you tend to, as you get older, you tend to have high blood pressure. You don't work out as much. You gain weight. You have more stress, maybe because of work. You're not sleeping well, and your testosterone level decrease as you get older, as well too. So all of that compounded as to why men, when they're older, have ED. So I hope
Okay.
I'm able to give some strategies on, to kind of get out of overthinking about it, and just let your body enjoy the moment.
I'm curious as we're talking about the brain, if you ever use the peptide PT141
Hmm.
in men. Do you have much experience with that?
Yeah, yeah, we use it sparingly, and
Okay.
not to say that I don't use it. I use it in men, but what I find is that they have more side effects than they enjoy the
Hmm.
benefit of that, right? So PT141 works by really helping with arousal in the brain, all
Hmm.
right? It really stimulates the nerve as well, and so it helped with arousal, but unfortunately, because of the way it worked, it also caused a lot of nausea and vomiting,
Hmm.
even at low doses. And what we observe is that men, tend to, and we don't know at what dose they're going to react to. So we start low, and then we work up to the dose, depending on what they can tolerate. But unfortunately, some men have a reaction even at the lower doses of nausea, vomiting. I mean, I'm talking about not vomiting like that hour, but like for a couple of days. I have a patient that took PT141, and he was vomiting so much he had to be hospitalized because he became dehydrated. But it does work in some. So, if that does help, I prescribe it. But in my opinion, it's a 50-50. And some men does not have the side effects, and some men do. But what happened is that when we increase the dose, that will help with the arousal. We find that they start having side effects of the nausea and the vomiting. Well, I would tell you that there is a medication that for women, Felici, there's a medication for women that came out. Is that Felici, the one that's the pink pill?
Hmm.
I'm
Yep.
blanking
Yep.
on, yeah, yeah, Valici, that men can actually even use, and that may help with arousal as well too. So that's
Hmm.
not for women. It can be for men as well too. But it's not all clear cut. You try and you see how it is, but oftentimes you don't need a medication to get yourself aroused. It's like
Hmm.
almost like, well, you try and see if it helps, but in my opinion, you really don't need a medication to get yourself aroused. You can kind of focus on what I call the five senses that you have, and be able to kind of relax your mind. And that would probably be as effective as PT141 or even Valisi.
Gotcha. Okay. Well, next on your list, you have hormones. And I've certainly talked a lot about hormones on this podcast, and certainly in my clinic. I kind of specialize in hormone replacement therapy in men and women, and it's a large part of just health optimization in general, in my opinion, and certainly as well as sexual health. But what is your approach as it pertains to hormone optimization?
Right. So, I mean, obviously, when a patient comes to see us for ED, we always get complete blood work. And it's like 18 tubes. It's a lot. So we look at all the hormones that's being released in the brain, such as FSH, follicle stimulating hormone, LH or luteinizing hormone. And then we look at prolactin, we look at thyroid hormone, and we look at cortisol, which is the stress hormone, and we look at testosterone. So, if because the cortisol rules everything, right? So if the cortisol is high, it's going to affect your testosterone, it's going to affect your thyroid, it's going to affect your sex drive. So you got to kind of control the cortisol. So we look at all of that in addition to just to testosterone as well. We look at the total testosterone and the free testosterone, and I have to say that if testosterone is low, it doesn't necessarily mean that's the reason why you have ED, right? Now, the penis muscle has a lot of receptor for testosterone on the penis muscle. Yes, so having good testosterone level will contribute to a good erection, but it doesn't necessarily mean that you have low testosterone. That is the only reason why you have ED. Because studies have shown that in men with ED, if you supplement the man with testosterone, their ED doesn't improve. They still have to work on the stress management, have the diet, the exercise, and the sleep. All right. So having said that, if the a man is low on hormones, and like I said, ED treatment is the multimodality approach. That's why we have the six system. It's a multimodality approach, and along with using stem cell to restore blood flow in the penis, and Botox to relax the muscle in the penis, and shockwave therapy, which is focused shockwave to restore blood flow in the penis. And I can talk more about that later. But with the hormones, since we're talking about hormones, is that if I find that the testosterone hormone is low, then I would, I'll recommend testosterone replacement therapy with either injection or with pellets. What we do most of the time. Pellets, an implantable little
Mhm.
a white pellet that's the size of a Tic Tac. We put that underneath the skin and the buttock, and it releases testosterone for 4 months. And then 4 months later, the man gets reimplanted in the other cheeks, to fill up the testosterone. It's almost like filling up with gas when your tank is low. But we also look at controlling cortisol. Again, cortisol is the regulator. If cortisol is high, it's gonna affect testosterone as well. And then if cortisol is high, you're gonna convert to estrogen from testosterone. So we also work on lowering the cortisol level with supplements. And then we also address the thyroid. If the thyroid is involved, we'll address that as well. And so testosterone. One of the things about testosterone we observe is that it does help with libido. It does help a man with libido. It helps with his mood a lot too. It does help with improving depression and reducing anxiety. And what we find a lot with testosterone is that it helps with motivation. It helps the man get more motivated to go to the gym, or more motivated to complete his task, and definitely more energy. More energy and more focus. And since I'm a pain management doctor, we also noticed that supplementing testosterone actually help with pain, like back pain, knee pain, and neck pain. Because testosterone is a steroid, and it's an anabolic steroid, so that means that it repairs as well. Not just only with men, we see that in women as well too. I can't tell you how many times I see patients for their back pain, and I will do treatment, and then we start them on hormone replacement therapy. They don't have any pain anymore. They feel great. The back pain, improve a lot with hormone replacement therapy. So yeah, I believe that hormone replacement therapy is really anti-aging and improving quality of life. And if you're a guy, under 50, you need to get tested, and you should consider testosterone replacement therapy if you're no longer planning to have any children. Because one of the side effects of testosterone is that it decreases sperm cell count and also make the testicle a little smaller, and also increases the red blood cells of your blood and make your blood a little thicker. But all of that can be easily treated with the thick red blood cells can be easily with just donating blood.
Yeah.
Go to
Yeah.
American Red Cross and donate the blood.
Yeah. Okay. Well, let's talk about the nerves. Obviously, if they're involved and if they've been damaged, can certainly contribute. What is your approach to checking that and treating that if there's some type of a nerve problem?
Well, the nerve problem, and I mentioned that, is really for in order for a man to get an erection, he needs to be uh um tapping into the parasympathetic nervous system, which is then again your autonomic nervous system. It's not something you voluntarily control. Those nerves run on the side of your spinal cord, and the parasympathetic nervous system is responsible for erection. The sympathetic nervous system is responsible for ejaculation as well. But then there are also nerves that run down that are in your control. That's called the pudendal nerve, and that comes out of kind of where around your sacrum is as well. So the reason why I mentioned that is because the nerve runs out in a complex web that goes to your penis. And the mention I mentioned about that is that the nerve has to be functional. So if you're diabetic, then the diabetes, is it uncontrolled, is going to affect the integrity of the nerve functions. You're going to have less sensitivity, and that will affect erection quality. And also, if you have benign prostatic hypertrophy, or BPH, which is the enlargement of the prostate, the nerve also runs on top of the prostate that before it goes to the penis, that gets compressed as well. So BPH, or enlarged prostate, does not directly cause ED, but it can kind of contribute to it because of the nerve that run through it as well. So what can you do? Well, you can control what you eat and exercise, so that way you can control your blood sugar, so that way it doesn't damage the nerve. And that, interestingly, with prostate, if you eat better, your prostate size will not increase as much, and that if you keep your testosterone level at a sufficient level, your prostate will not enlarge either, because the prostate, get enlarged when testosterone level are less. So it's a very complexity of the nerve system. So the simple way of saying it, all right, so the nerve is there. What should I do? Well, diet, exercise. I always say, yes, we have the sixth system to address restore function, but the four pillars to restore sexual function, always back to what you can do. Diet, which is the Mediterranean diets. I recommend exercise, and I recommend just like even body squats, body weight exercise. You don't have to go to the gym, but if you can, you do high intensity interval exercise. But even just doing a body squat, push-ups, sit-up, and walking is adequate enough. And getting adequate sleep, getting at least 7 hours of sleep at night, or daytime if you work at night, and then just stress reduction. I know that's hard for men to reduce stress. Men internalize their stress. They don't talk about it like women are. But just know that if you're stressed, yeah, then it's gonna affect your cortisol level, which then affect everything else. So, what ways to use to release stress? What watch your football or exercise or hang out with the guys or go on a vacation. Just kind of things like that will help reduce the stress. So I know we're going to the sixth system, but I keep going back to like, okay, what can I do to improve my sexual function? We go to the system to explain why you have ED and why we do what we do in my office as the multi-modality treatment in addressing the brain, the emotion, the nerve, and the blood vessel, the penis, and the hormone.
So the last two are blood and muscles, which we've pretty much talked about that, and obviously it comes back to like you're saying. I mean, exercise and lowering blood pressure and eating better and all that stuff. As it pertains to blood, you've mentioned a couple of times. It doesn't sound like you're a fan necessarily of the medications, the Viagra, Cialis, and that kind of thing. Do you ever use those, or do you not like them, in any
Um,
circumstance?
I rarely use it, honestly, because my goal is to get men functioning without medication. And it is possible because we've seen it in men that had ED for 20 years and is able to get an erection again without medication. We see in men that had prostate surgery and was able to get erection again. So we've seen the worst cases and they're able to get erection without medication. The reason why I'm not a big fan of medication is because it makes you lazy and it just
Hmm.
doesn't treat the root cause of the problem. It's like it's like you when you take a diabetic medication, right? It really doesn't mean you don't have diabetes. You're just preventing the consequence of having high blood sugar. But if you exercise and watch what you eat, then you don't have to take that medication. With the same
Hmm.
thing with ED, if you take the medication, what those medications do is that it increase blood flow to the penis, but it doesn't treat why you have ED. It doesn't treat that. So what happened is that the reason why you have ED worsen over time. But you don't treat it. You don't treat the problem. You ignore the problem. You just take the medication. So what we find out with men that are on Viagra and Cialis, it's about between 2 to 5 years to stop working. And then you have to escalate the dose until you see it working. And then the progression is to a penile implant. You don't want to get there. But
Hmm.
what you want to do is to find out, well, why am I not getting an erection? It's because I drank too, I did a little, maybe I should go down in my alcohol content. Maybe I should eat a little bit better. I exercise more, watch my weight a little bit, and sleep better. But if you start doing that, you're not going to need the medication because right now men are being brainwashed that if they're not performing well in the bedroom and their erection's not as good as it used to be, the next step is Viagra and Cialis. That's the worst thing you can do. It's almost like taking a pain medication for your back pain, right? Because
Gotcha.
you're not treating the cause of your problem. And then what happened, that and one reason why I'm passionate about this is because when you have ED, ED is a warning sign of your general health. And it's because the blood vessel in the penis, is about 1 to 2 millimeters. Very, very small, the size of a rice grain. The blood vessel in the heart is 4 millimeter. So what that means is that if you're starting to have decreased blood flow in the penis, about 7 to 10 years down the road, 67% of men that have ED a decade later are gonna have a heart attack.
Hmm.
So it's a warning sign that hey, I'm getting blood flow in my penis. Let's pay attention to this. If you don't pay attention, you keep popping that Viagra and that Cialis. Well, a decade down the road, you're gonna have that heart attack, and it may even be a fatal heart attack as well. And the side effects of the ED medication is that it lowers blood pressure to a point you can pass out and even have heart attack as well as stroke. Several of my patients have known friends that died in the bedroom in the middle of sex because they took too much Viagra,
Hmm.
and their blood pressure just plummeted. that they literally passed out. So there are very, very dire consequences. Also, studies have shown that long-term Viagra use will cause eye more loss of vision as well as hearing loss as well too. So there are definitely long-term consequences.
We're running out of time, but I want to ask briefly about some of these kind of more novel treatments. Specifically, I want to ask about the Botox, which you mentioned briefly. There's things like PRP and sound wave therapy or sound wave devices. I've
Uh-huh.
talked about PRP before on this podcast, so if you're interested, you can go back and find that. But I specifically want to ask about Botox because it's a
Mhm.
pretty new therapy, and I'm just kind of learning more about it myself, and actually I've considered offering that here, but
Yeah.
I just because I see a lot of men, but I just haven't done that yet. Tell us about that and kind of what your experience has been with that.
Yeah, and I teach doctors on my protocol. I want more doctors to do this protocol as much as possible. So in 2022, there was a study in Israel that came out that they were giving Botox injection to about 60 men, and they found out with just Botox alone, um, Botox A, a cosmetic Botox A at 50 units and at 100 unit, they noticed that it improved erection in men that fail. That's a big word. Fail Viagra and Cialis. So that's pretty awesome. So they found that in that group, and that was compared to placebo. Placebo, they just get saline injection. So how and there was another study that came out in Korea, which also validated that as well. And I think there's been three studies that came out that has looked at the effectiveness of Botox, and the Botox at 100 unit works better than 50 units to last longer. How Botox works is that Botox is the muscle paralyzer. That's why women now men also get it in the face because when you inject it in the muscle in the face, it kind of paralyzes the muscle and therefore takes the wrinkles away. Well, the same thing happened in the penis. So the Botox is injected in the penis. The penis muscle is a smooth muscle, but it's also a muscle. So when the Botox injected into there, the smooth muscle of the penis are paralyzed, meaning it becomes more flaccid and it becomes more relaxed. And when it becomes more relaxed, it will allow more blood flow to flow into the muscle. And remember when I said at the beginning of this podcast episode that in order for you to get an erection, your brain gotta be relaxed and your penis muscle gotta be relaxed. Well, by doing the Botox, your penis muscles relax all the time. So what we find is that the with injection of the Botox, that men are a little bit larger in size at rest when they're not erect, as well. And we also notice that they actually improve size when they are erect at about maybe like a half an inch as well, because it relaxes the muscle and the muscles relax all the time, but it does not in any way interfere with the way how you urinate, because the penis is has three functionality, right? To help men urinate, bring urine out of the bladder, and also for ejaculation, and it's also an erection, right? So it has three things, but it does not affect how you ejaculate, it does not affect how you urinate at all. And so we found that it actually helped with erection. But in our treatment, we combine that with platelet-rich plasma, which are stem cells from your blood that are called platelets that are already in your blood that comprises 1% of the whole blood, and we inject that into the penis as well. And we also combine that with shockwave therapy, which is the sound wave. It's not the gains wave. We do focused shockwave, which uses stronger energy that deliver the shockwave to the penis. And how the shockwave works is a little bit different than the Botox, is that the shockwave um, goes in and kind of deliver like a more blood flow kind of like detoxify the muscle and help with making more blood flow in the penis. The platelet-rich plasma or the PRP also does the same thing. It also heals, it
Mm,
rejuvenates the muscle of the penis as well as help when increasing blood flow. So you got the shockwave and the PRP increasing blood flow, and you got the Botox to relax the muscle. So a combination of all three is really a way to kind of like repair the penis in order for it to get an erection. And then we always, along with that, coach our patient on lifestyle changes such as diet, exercise, sleep, and stress, because all that those four pillars work on the inside of your body.
hmm.
I can work on making the penis, with getting more blood flow, but I the only way for you to change your heart, your blood vessel is through what you eat and your exercise level. That's something you have to do. But we coach our patient through an app as well as having an accountability person in our office that work with them throughout the whole journey.
Yeah. Back to the Botox real quick. Is there any downside to that? And I guess what I'm thinking is if it's relaxing the penis all the time, of course, Botox lasts what, several months. Is there any concern of priapism or anything?
No priapism at all because it doesn't increase blood flow, right? And it doesn't constrict. So there's no risk of priapism. The only thing that they found in the study, we have not seen any one of our patients have any problem. We've injected probably 1,000 by now
Really?
with Botox, is that if anything, a little bruising.
Mm,
The men is loving the increased size.
interesting. Yeah.
Yeah, the increased size when they're not erect, and also Botox also help with it's called neuromuscular transmission, where the transmission of the nerve to the muscle also improve with Botox as well too. So I didn't really say
Interesting.
that, but if you're gonna get geek out about Botox, it not only help with the muscle, it also help with the transmission of the nerve to the muscle as well too.
Yeah. Is this something, are you just injecting it like on both sides, kind of at the base
Yes.
and directly into like the corpus? Is that basically
Yep,
what you're doing? Or?
we inject it directly in the corpus cavernosum at 3 o'clock and at 9 o'clock. Of course, you want to avoid the top of the penis, is where the blood vessels are and the nerves are. And you want to avoid the bottom of the penis at 6 o'clock because that's where the urethra is. So
Hmm.
you
Hmm.
only want to do it at on the corpus cavernosum around 3 o'clock and 9 o'clock.
Okay, interesting. Well, okay. Well, I guess we need to wrap up here, but
Hmm.
tell us, if you will, about how people can find out more about you. You have a YouTube channel, and then any other kind of social media you'd like to give us to where patients can learn more about you and kind of
Yes.
listen to you.
Right. Well, thank you for having me here, and I hope that your listener find value in what we discussed about. And just know you're a man or woman, and if you have ED, if you know somebody that has ED, there are alternative beside medication or surgery for it. And so check out my YouTube channel. Just go on YouTube, and then you just type in Dr. Ann Trunk. So Dr. Dr. and then Anne, my first name, Trung, Truong, and I'll pop up. Or you can just do youtube.com/at Dr. Ann Trung. That's my channel where we literally spill the beans on everything you need to do for sexual health. I give a lot more tips on that on my channel, and then also check out our newsletter as well. So we have a free newsletter on sexual health called The Modern Man, and it's all about fitness, wellness, and of course sexual health as well. And that is you can actually see the newsletter on our YouTube channel, or you can go to my website, truongrehab.com, TRUONGREHAB.com, and subscribe to the newsletter there as well. So we have all sorts of good tips in the newsletter as well as in our YouTube channel. We give away the Mediterranean diet, a Good Morning Wood smoothie on our YouTube channel. And that we're actually going to be holding a challenge. We're going to be holding, we're going to do a 5-day challenge where we challenge men to really work on getting their sexual functioning rejuvenated, improved, optimized for 2025. So stay tuned for that, that we're going to launch it in January. But my whole point is that your sexual function should be like blinking your eye. You don't need a medication for that. Oftentimes, we just don't know what to do. So that's
Hmm.
why we think it's a medication, where it's really as something as simple as changing what you eat. I have many men coming in to see me for ED, and I only reserve what our treatment, the Get Hard system with our treatment, really for severe cases. But in some case, I just kind of advise them, hey, you got to eat a Mediterranean diet. You got to, stop smoking, stop drinking a lot of alcohol, eat clean, eat clean. And oftentimes men just make the decision to, oh, I'm just going to stop smoking. I'm just going to eat less French fry, drink less Coke, drink less, eat less pasta. And Lord and behold, they're having morning erection again, and their
Yeah.
testosterone level improve just by doing simple things like that without
Yeah.
any treatment from me or without medication.
Yeah. Yeah. It's amazing how many things can be cured by just going back to that.
Yeah, just going
um,
back to the basics, because I would
yeah.
tell you, in the caveman era, no man has ED. I can tell you that because they run, they exercise, they hunt for their food, right?
Yeah. Right. Right. Right.
And they're not overweight, right? They're not overweight and they're active, they sleep well. So I don't think any of the men in the caveman area have ED, but unfortunately, we're seeing the prevalence of ED higher and higher now, and it's appearing now even in younger men in their
Yeah.
20s.
Yeah. I see that as well. Yeah, for sure.
Yeah.
So, well, thank you so much. As we wrap up, I always ask my guest if they could give us one health tip that would make us healthier today. What would you say to that?
Yeah, that your health is in your control, and it is you got to make the decision to do one thing. What the best thing you can do is to eat healthier. What I say is that this is for men and women. Is that your body is what you feed it, and so don't eat anything out of a box or in a plastic bag to make it simple.
Yep.
And the more vegetables you eat, more lean meat you eat, the better it's gonna be. Eat kind of like what the caveman eat,
Yeah. Yeah.
and what you feed it, you will find you will have more energy, you will actually lose weight, you will actually sleep better, and you'll find that you'll probably have better sexual function.
Well, thank you so much, Dr. Ann Trong. Appreciate your expertise on this and appreciate everyone listening. And we will talk to you next time. Thank you for listening to FitRx. I invite you to share this with friends and family. If you would like to contact me, you can visit our website at fitrxwellnessok.com, or you can email me at drgreg@fitrxwellnessok.com.